Hello everyone. This is Sova TV. Today, we would like to inform you that there are reports of serious symptoms that appear after recovering from COVID-19. So you need to be careful for your health and safety. Sadly, many sequels have been reported. As of August 22nd, the number of confirmed COVID-19 infections in Serbia is 30,500 and the death toll is 695. The number of infected people worldwide has been confirmed by more than 23 million, with more than 800,000 deaths. What we should pay attention to is that many countries do not test for deaths who has already died, so the actual number of deaths from infection may be higher. In particular, young people and those who are confident they are healthy often treat COVID-19 as a severe cold. However, the medical report does not. In the case of the United States recently announced, the number 1 death rate is from heart disease and cancer, and the third is from influenza and pneumonia. However, before COVID-19, in 2017, deaths from influenza and pneumonia were ranked 8th. The peculiarity of COVID-19 is that many people are asymptomatic or non-severe, but for some people it is fatal and has a variety of damaging areas. The Washington Post reports that the symptoms of COVID-19 appear in various areas including the brain, eyes, olfactory function, blood and blood vessels, digestive system, lungs, heart, kidneys, skin, and immune system. Many people have recovered from COVID-19, so there are many reports of recovering people suffering from sequels. Let's look at the reported symptoms. The following case is a symptom of a person who still complains of sequels 5 months after the decision to recover. First, the brain fog phenomenon often causes the head to feel like fog, pain, and difficulty concentrating. Second, chest pain that makes the chest uncomfortable when sitting. Third, stomach pain with burn symptoms. Fourth, skin that turns purple and dry skin. Fifth, feeling tired from time to time. These are typically the sequels experienced by some people who recover after infection with COVID-19. Let's look at the research results and reports on the sequels. Science magazine is also reporting on the sequels of a 38-year-old woman who has been unable to go out due to poor health for more than 4 months after receiving a recovery decision. This woman is said to be a woman who regularly exercises at least 3 times a week. This woman had a high fever for 3 weeks after the confirmation of COVID-19, and after that, after her body temperature returned to normal, she was judged to recover, but it is said that various symptoms do not disappear until now. More and more people are complaining about the same sequels online as well. Science magazine said that there are insomnia, dizziness, joint pain, arrhythmia in which the heart is beating irregularly, high blood pressure, and shortness of breath. Shortness of breath may be due to damage to the lungs, causing some parts to stop functioning. As with SARS and MERS, pulmonary fibrosis is found in some patients. When lung fibrosis occurs, you may have to live with reduced lung function throughout your life. What scares us even more is that even among patients who have not had severe symptoms, but there have been reports of sequels. This table shows the results of a follow-up study of hospitalized patients infected with COVID-19 in an Italian hospital. This is the percentage of patients' symptoms at the time of COVID-19 diagnosis. The right side is a symptom that remains after being diagnosed with recovery and discharge from hospital. Although symptoms have diminished, it can be seen that many people suffer from sequels. It is true that more studies and cases are needed to medically confirm the sequels of COVID-19 so far.
Importantly, doctors have not been able to figure out how to treat the sequels. It is true that the number of deaths among younger people is quite small when looking at the statistics of people who died from being confirmed by COVID-19. However, if you are unlucky and have sequels, you may be unable to exercise due to lung, joint, or blood vessel problems. Or if your brain function is deteriorated, people with a job that requires to use the brain may not be able to work. COVID-19 has so many things we don't know yet. You shouldn't underestimate the risk. Simply seeing only a few % of deaths and a few % of recovery. With positive news coming out continuously for vaccine development, it's time for us all to work together to keep ourselves and those around us healthy for a few more months. If you are curious about vaccine-related news, please check the video on Sova TV. That's it for this video.
pritisnite subscribe, like i alarm. Ostanite bezbedni i vidimo se u sljedećem videu. Hvala vam!